Dr. Michelle Jongenelis, it's great to meet you at the World Conference on Tobacco Control. What are you looking forward to about this event?
I'm really looking forward to seeing how different countries are tackling tobacco industry interference. I think it's one of the biggest challenges that we face at the moment. They're coming out with novel products. As we improve our legislation around tobacco cigarettes, they are noticing a decline in smoking. That's, what we all want. They don't want that. They are a profit-driven industry, so they're coming out with new products to addict a new generation, and they're interfering in our public policy. And so I really want to hear from different countries, see what approaches they're using to really tackle that industry interference in policy making.
Perfect. And in Australia, how are they interfering? What are you seeing at the moment?
Oh gosh, where do I start? There are a lot of sort of media pieces claiming that we've got countless fire bombings and kids are just able to walk into any store and buy these products, and our tobacco laws are failing and our vape laws are failing, and it's really not true. It's not as bad as they say it is. Yes, like any country, we have an illicit market, but we only introduced our laws last year. We're still working on compliance. We have seen a reduction in the number of vape stores that are selling vapes, and some of them have actually closed. So the data just really isn't matching up to what the industry is saying, but unfortunately the media grabs onto this scaremongering and the stories that the industry is telling, so unfortunately we've seen a flourishing in their narrative getting out there.
What are the early things that you're seeing after these measures were put in place, and why is it a good thing?
Yeah. So in Australia we introduced what's called the pharmaceutical scheme, and so what the government understood was that in Australia, e-cigarettes are considered a second-line treatment for smoking cessation. So if you've tried those first-line products and you haven't been able to succeed and you want to give e-cigarettes a try, you can go to your GP and you can have that discussion with your trusted health professional and get the support you need to try and quit. We recently passed legislation which means you can go to a pharmacy and have a chat to your pharmacist about accessing a product. What this means is we didn't need the retail scheme. We didn't need those retail stores, convenience stores, if you will, to sell these products, because smokers or those who smoke could access these products through a pharmacist and access that support that they need, not just the product itself, but the counselling that comes with it, which we know is an evidence-based approach to quitting. So when we talk about we're seeing the retail stores close, that's a good thing in Australia, because it means that children can walk down the street and not see a store. And what we know in Australia is that we had stores that opened up right next to high schools, right next to primary schools even. We wanted to do away with that, which is why we introduced that pharmaceutical scheme. So we're still allowing access to those people who might benefit from the product, but we're also protecting our kids who face so many harms from using this product.
What is the industry telling you in Australia about what's happening in the UK?
Well, they're saying, and it's not just industry, it's also sort of industry actors. It's not just the tobacco industry. I think we need to be aware of that. There are people that are often not disclosing their conflicts here, but they will say that the UK is doing a great job and, seeing massive decreases in smoking, when we know that's often not because of an e-cigarette or vaping. It's because of a plethora of other tobacco control measures that have happened over the years. And I was in the UK last week, I was in Glasgow, and I was just astounded at the number of stores that were selling these brightly coloured packages, and this is £9.95 for a pack of 30 or whatever it is, and we just don't have that in Australia, and rightly so, because we don't want to have our children walking past every second store seeing these clearly appealing products for them.
And in Scotland we are seeing a massive rise in youth nicotine addiction through e-cigarettes, through nicotine pouches, and they're trying out various other products. I don't know if you're seeing an issue with nicotine pouches in Australia.
Absolutely. We're still a little bit behind the UK and Scotland and England. It does come a little bit later to Australia, but we are certainly noticing over the last year or so that we are seeing a lot of kids start to experiment with these products and use them. What we're hearing from them is that the user experience isn't very good. So they will put this product in their mouth, and because it contains such high amounts of nicotine, nicotine, they'll throw up or they'll faint straight away. So the user experience isn't that great. But, you know, concerningly, we're also seeing this sort of theme of masculinity as well. If you can put up with that poisoning, then it makes you a real man, which is again another concerning development in the industry's plethora of products.
To me, they are using the same playbook that they use to embed and market tobacco for these new products.
Absolutely. They're putting it in the hands of celebrities, right? They did the same thing with e-cigarettes. We saw Leonardo DiCaprio walking the red carpet with an e-cig in his mouth. Now we're seeing Josh Brolin talking about how he uses nicotine pouches 24 hours a day. Premier League soccer players are putting them in their mouths. Managers. That's how, anecdotally, we've run some focus groups. And that's the sense that we're getting, is how they've reached young males so quickly, is they'll often say, well, the Premier League players are using it, so it must be good, it must be okay, it must be healthy if they're using it for them. So there are certainly some concerning developments that we're monitoring very closely.
So Ash Scotland takes a precautionary view with these products. We only actively recommend those that are on medicinal licence, which none of these recreational novel products that have nicotine are. How would you see that we could collaborate in the teeth of this well-funded, massive set of corporate multinationals?
I think we have to stick together. I think we all have to be singing from the same hymn sheet. But I think what makes us unique is that we're always evidence-based. We always look at the evidence and we go, is there enough evidence for, you know, us to allow this product to be widely available? And also looking at the risks and benefits for different population groups. It's one thing to sort of say, well, this might help smokers, when people who smoke only make up, maybe, certainly in Australia, 10% of the population. So we're risking 90% of the population to maybe help 10%. The evidence just isn't quite there yet. So I think as organisations working together, it's sharing the evidence, sharing what we know, and making sure that we are being evidence-based in all our discussions.
And anything else that you'd like to say from your experience and work before I ask you a wrap-up question?
Well, I think we need to be better in general around targeting harmful commodity industries. So this extends beyond the tobacco industry. We've got the alcohol, we've got gambling, ultra-processed food. All these industries, you mentioned the playbook earlier, they are all using the same corporate political playbook. And there are some decision makers and some organisations that are falling for that crap, so to speak. So we need to be better, and sort of, you know, funding always helps. We need to be more resourced than they are. They are bringing in trillions every year, and we work with a couple of thousand sometimes. We're constantly hustling. So that would be, my key message is let's leverage the resources that we do have.
And is there any advice you'd like to give the UK? And is there any encouragement you'd like to give Ash Scotland?
I'd say don't listen to the tobacco industry. They should not be allowed in the room. They should not be making the decisions for you. I would always caution against anything that has to do with a vested interest, not just the tobacco industry, but also the retailers, right? At the end of the day, these organisations, these people are selling a product that kills people, and we are allowing that to happen. And so my advice would be, do whatever you can to stop them from killing people. I mean, it seems pretty simple in my mind, perhaps not, but and then in terms of Ash Scotland, just obviously keeping up the great work that you're doing in the fight against the tobacco industry and also the independent vape industry when with the independent retailers that come out as well. Like, just, we really appreciate having having an organisation from the UK that is evidence-based and that is looking at the evidence and is saying there's no evidence for us to recommend this as a widespread tool just yet.
So Michelle, thank you so much for speaking with us, and thank you for the encouragement